Our coverage of coronavirus continues tonight with more answers to some of your most pressing questions. And in tonight's Around the Table, we welcome Dr. Joe Suyama, Chief of Emergency Medicine Services at UPMC Magee Women's Hospital. Thank you for joining us, Doctor. All right, so we solicited questions from our viewers, and let's start with our first one. Number one, if you're feeling sick, should you go to the doctor or hospital? I'm hearing conflicting information. Should you just stay home?
So if you are concerned that you may have coronavirus or the COVID-19 disease, but you are feeling well, you might have a low-grade temperature, and you're not experiencing respiratory difficulty, then it's absolutely fine to call your primary care doctor and to discuss your symptoms with them.
Okay, so your first bet should not be to go to the hospital.
Whenever you're concerned about severe symptoms, worsening symptoms, particularly from a breathing perspective, or if your fever is very high. We are always there from an emergency perspective to see you. We are prepared to accept patients that may have this condition, and you will be directed to the appropriate location in our hospitals.
Right. Okay. Another question. How does a doctor determine who should be tested for coronavirus? This person says, I have several friends who were sick and they weren't tested.
So individual physicians are seeing the patients in the community and in the hospitals. Our current system at UPMC is to make sure we identify all of these patients during their hospitalization, and a phone call is made to our specialists, our infection preventionists. What they do is they assess the information, take the clinical information, epidemiologic information, share that with the state. So the Department of Health shares in the decision making currently about who gets tested, and once that information is brought back to us from the state, we will determine if that patient requires a test.
Okay, great. Here's another question. If you get coronavirus, do you need to be symptom-free before ending quarantine? And how long does the virus actually usually last?
So this is a very evolving situation, and the more we learn about this particular condition, these details may change. But currently the guidance is that once you are symptom-free and your fever has broken without the use of antipyretics or things like Tylenol or ibuprofen to keep your fever down, they will clear you by doing two things. One is they'll make sure clinically you're fine, and then they'll assess you with a test. So once you have had the disease, you're confirmed as having COVID, you will have to be symptom-free, and your tests need to be negative.
For how long again?
Your test will be performed at the time you're considered to be symptom-free.
Oh, okay.
And so when you have two negative tests, at the time you either leave the hospital or are allowed to break quarantine at home, that is when you're allowed to resume regular activities.
So you get tested again at the end to make sure it's out of your system?
Yes.
Okay, great. Here's another question. How long could you be infected before you even show symptoms? A few days, hours?
So what we're talking about here is the incubation period. The incubation period for viruses vary, but for this particular disease, as we know it, it's about 2 days at the shortest and 14 days at the longest before you show symptoms.
And so that means people could potentially be walking around with it and not even know they have it.
Exactly. Many people who have this condition, who may not be particularly communicable, that's still also up to debate, may have the disease but not be symptomatic for that first 2 days and up to 14.
Okay, great. Here's another question. Is it true that the elderly are the most likely to get the virus? And if so, do you think nursing homes should be under quarantine?
That's a very good question as well. We see and we hear so much about the vulnerable populations, and that's the context in which this should be taken. People who are at risk are different than the people who are most likely to get the disease. The ones that are most likely are the ones that are at these mass gatherings, that are in high-risk locations geographically, so that's to be differentiated from the vulnerable. But we don't want our older patients to get the disease because they are at the highest risk of having poor outcome.
So older people are not necessarily more likely, but if they get it, they are more likely to have worse symptoms.
Exactly.
Okay, got it. Here's a question I really want to know. I didn't write this question, but do you really need to avoid public places? Is it safe to go to places like the mall or to go out and run errands?
Well, this question was a lot easier to answer a week ago, and actually maybe a lot easier to answer a week from now. But as we see, even the Penguins, the NCAA, and many other universities in the area are closing for the remainder of the season, we see these drastic measures being performed, and we wonder what our part is in all that. And when it comes to going to public places, the unfortunate thing is that's a risk-benefit analysis that individuals need to make. The guidance is avoid mass gatherings if it's inappropriate or if you are able to avoid them. But the last time I checked, it's not easy to avoid going to the market for food. So those are things that cannot be fully discouraged, but you have to understand your risks.
Okay, great. And here's another good question. Should parents keep their children home from certain activities, maybe tutoring or dance class, because of coronavirus outbreak?
Well, many times you're going to get decisions made for you. Those businesses or the enterprises that your children might be going to will already have directives in place from either their regional directors or from even local authorities. But I think the most important message to take there is that if your child is sick, don't have them participate in those group activities and keep them home.
But you're saying basically as long as it's still open and your child's not sick, use your judgment?
At this point in time, as we start to see all these closures from a public health perspective, again, this is a greater good we're doing for the community. Individuals need to take into consideration our role in decreasing the spread of disease and making sure that we do our part, but also to keep each other safe. So,
Dr. Suyama from UPMC Magee Women's Hospital, thanks for all your great answers.
thank you very much.